Welcome to the Chanel Now. Today, we discuss the managing chronic pain is a complex and deeply personal journey that millions of people around the world face every day. It can take many forms, including back pain, joint stiffness, nerve discomfort, headaches, fibromyalgia, arthritis, and more. Chronic pain is defined as pain that persists for more than 3 months, and it often continues even after the original injury or underlying cause has been treated or resolved. For many, chronic pain is not just a physical experience but an emotional and psychological burden that affects every aspect of life, from sleep and appetite to work, relationships, and mental health. Unlike acute pain, which serves as a warning system for the body, chronic pain can lose that protective function and instead become a daily challenge to manage. It often leads to frustration, isolation, and a feeling of helplessness, especially when treatments don't seem to offer consistent relief. Understanding the many dimensions of chronic pain and developing a comprehensive, balanced approach to managing it can transform the way people live and help restore quality of life. One of the most common forms of chronic pain is back pain, particularly in the lower back. This can be caused by injuries, herniated discs, poor posture, muscle imbalances, or degenerative conditions like osteoarthritis. For many individuals, back pain is worsened by prolonged sitting, lifting heavy objects incorrectly, or not engaging in regular physical activity. Managing back pain often begins with identifying specific triggers, such as bad ergonomic habits, and making changes to reduce strain on the spine. Simple lifestyle adjustments, such as using lumbar support cushions, standing desks, or taking frequent movement breaks during the day, can significantly reduce discomfort. Physical therapy is another essential tool in managing chronic back pain. A skilled physical therapist can design a personalized program of stretching, strengthening, and mobility exercises that help stabilize the core, support the spine, and reduce tension in surrounding muscles. Gentle stretching routines and practices like yoga or Pilates can also be beneficial, especially when done consistently. Exercise plays a crucial role in managing chronic pain of all types. While it may seem counterintuitive to move when you're in pain, the right type of movement can actually reduce pain, increase mobility, and improve overall function. Low-impact exercises such as walking, swimming, biking, or Tai Chi help maintain joint flexibility and muscle tone without putting excess stress on the body. These activities also stimulate the release of endorphins, natural chemicals in the brain that act as painkillers and mood enhancers. Regular physical activity helps improve blood flow, reduce inflammation, and prevent the deconditioning that often occurs when people limit movement due to pain. For individuals with joint issues or arthritis, water-based exercises like aqua therapy can be especially helpful because the buoyancy of water reduces pressure on the joints. Developing a consistent exercise routine tailored to your abilities and limitations is key. It's important to start slow, listen to your body, and gradually build strength and endurance over time. In addition to physical movement, managing chronic pain effectively often involves changes in diet and nutrition. What we eat has a powerful impact on inflammation in the body, which is a key contributor to many types of chronic pain. Anti-inflammatory diets focus on whole, unprocessed foods like fruits, vegetables, whole grains, lean proteins, nuts, seeds, and healthy fats such as olive oil and fatty fish. These foods are rich in antioxidants and phytonutrients that help reduce oxidative stress and inflammation. In contrast, processed foods high in sugar, trans fats, and artificial additives can trigger inflammatory responses and worsen pain symptoms. Specific foods like turmeric, ginger, garlic, berries, leafy greens, and omega-3 rich fish like salmon and sardines have been shown to offer natural pain-relieving properties. Staying hydrated by drinking plenty of water throughout the day is also important, as dehydration can exacerbate muscle cramps and joint pain. Keeping a food diary can help individuals identify patterns or specific foods that may be contributing to flare-ups. Natural remedies and alternative therapies have gained popularity in chronic pain management because they offer non-invasive, often drug-free options for relief. Techniques such as acupuncture, massage therapy, chiropractic adjustments, and cupping therapy have been used for centuries in various cultures to treat pain. Acupuncture involves the insertion of thin needles at specific points in the body to stimulate nerves, muscles, and connective tissue, potentially releasing natural pain-relieving chemicals. Massage therapy can improve circulation, reduce muscle tension, and promote relaxation. Chiropractic care focuses on aligning the spine and joints to relieve nerve pressure and improve mobility. Many individuals also turn to herbal supplements like turmeric, boswellia, devil's claw, and white willow bark for their anti-inflammatory and analgesic properties. However, it's important to consult a healthcare professional before starting any new supplement or therapy, as not all remedies are suitable for everyone and some may interact with medications or underlying conditions. Sleep plays a fundamental role in the body's ability to recover and manage pain. Poor sleep not only increases sensitivity to pain but also affects mood, energy levels, and immune function. Chronic pain often disrupts sleep, leading to a vicious cycle where lack of rest exacerbates the perception of pain, and increased pain interferes with the ability to sleep. Creating a sleep-friendly environment is crucial. This includes a comfortable mattress, a cool and quiet room, and a consistent sleep schedule. Avoiding caffeine, alcohol, and heavy meals in the evening can also promote better rest. Relaxation techniques like deep breathing, guided imagery, progressive muscle relaxation, or mindfulness meditation can help calm the mind and body before bed. Some individuals benefit from using white noise machines, blackout curtains, or weighted blankets to create a more soothing sleep atmosphere. Chronic pain doesn't only affect the body. It takes a toll on mental and emotional well-being. Living with persistent pain can lead to feelings of frustration, sadness, anxiety, and even depression. It's common for individuals to feel misunderstood or isolated, especially if the pain is invisible to others. The emotional burden of pain can intensify the physical sensation, creating a feedback loop that makes the pain harder to manage. Developing strong emotional coping mechanisms is an essential part of chronic pain management. Talking to a therapist, joining a support group, or simply having a trusted person to talk to can provide relief and validation. Cognitive behavioral therapy, CBT, is particularly effective for chronic pain as it helps individuals change negative thought patterns and develop better coping strategies. Mindfulness practices and meditation can also reduce pain perception by training the brain to observe sensations without emotional reactivity. These practices cultivate resilience, helping individuals face each day with more control and less fear of their pain. Stress management is another crucial factor. Chronic stress can amplify pain signals and lead to increased muscle tension, inflammation, and fatigue. Stress also disrupts sleep, weakens the immune system, and worsens emotional health, all of which can contribute to the overall pain experience. Incorporating regular stress-relieving activities into your daily routine can help reduce the intensity and frequency of pain. Techniques such as deep breathing, meditation, journaling, spending time in nature, listening to calming music, and practicing gratitude can create a more balanced nervous system response. Exercise is also a powerful stress reliever, as it releases endorphins and helps the body process excess adrenaline and cortisol. Setting realistic expectations, learning to say no, and delegating tasks can also reduce mental overload. By managing stress more effectively, individuals often experience a decrease in pain levels and an improvement in overall quality of life. Occupational adjustments are sometimes necessary for those living with chronic pain. This may involve changing job roles, modifying workspaces, or adopting assistive devices to reduce strain and prevent flare-ups. Ergonomic furniture, standing desks, cushioned floor mats, and specialized tools can all help minimize physical stress during work activities. For some individuals, working from home or adopting flexible work hours can make a significant difference in managing pain while remaining productive. Open communication with employers and colleagues about limitations and accommodations is key. Pain-friendly work strategies might include scheduling breaks to stretch or walk, avoiding long periods of sitting or standing. Making these changes not only improves comfort and function but also helps maintain a sense of independence and purpose, which are critical for mental well-being. Medication remains a cornerstone of pain management for many individuals, but it must be used wisely and as part of a broader treatment plan. Over-the-counter medications like acetaminophen, ibuprofen, or naproxen are commonly used to reduce inflammation and relieve mild to moderate pain. Prescription medications, including muscle relaxants, nerve pain medications like gabapentin or pregabalin, and certain antidepressants, can also be effective for specific types of chronic pain. Opioids may be prescribed for severe pain, but they come with significant risks, including dependency and tolerance. Because of this, healthcare providers often aim to use the lowest effective dose for the shortest possible duration and combine medication with non-pharmaceutical strategies. It's important for patients to work closely with their doctors to monitor side effects, effectiveness, and the potential for misuse. Regular review of medications and open discussions about goals and quality of life help ensure that drug therapy remains supportive rather than harmful. Pain tracking is a useful tool for individuals to better understand their condition and what helps or worsens it. Keeping a daily pain journal can reveal patterns, triggers, and effective interventions. Entries may include information about pain intensity, location, activities performed that day, diet, sleep quality, emotional state, and any medications or treatments used. Over time, this information can help patients and healthcare providers make more informed decisions about what is working and what may need to change. Pain tracking apps offer convenient digital alternatives and may include features such as graphs, reminders, and integrated health data. These tools empower patients to take an active role in their treatment and advocate more effectively for their needs. Social support is another vital element in the long-term management of chronic pain. The presence of empathetic and understanding friends, family members, and peers can dramatically change how pain is perceived and managed. Isolation often worsens the emotional impact of chronic conditions, whereas being surrounded by supportive people can alleviate stress and offer comfort. Joining support groups, either in person or online, allows individuals to share experiences, tips, and encouragement with others who truly understand the challenges of living with chronic pain. These groups can be empowering, reminding individuals that they are not alone and that their experiences are valid. Encouraging loved ones to learn about chronic pain and how it affects the body and mind can also improve communication and strengthen relationships. Simple acts of empathy, listening without judgment, offering assistance, or acknowledging the pain without trying to fix it can create a safe and nurturing environment that supports healing and coping. Point 1. Often overlooked aspect of chronic pain is posture and body mechanics. Poor posture can place excess strain on the spine, muscles, and joints, leading to chronic discomfort or exacerbating existing pain. Whether sitting, standing, walking, or lifting, maintaining proper alignment helps distribute weight evenly and reduce stress on vulnerable areas. Learning how to move and hold the body in ways that minimize strain can be transformative. Ergonomic assessments, physical therapy sessions, and body awareness techniques like the Alexander technique or Feldenkrais method can improve posture and movement habits over time. Even simple changes such as sitting with feet flat on the floor, keeping screens at eye level, and avoiding slouched shoulders can significantly reduce tension. Using supportive footwear, practicing mindful movement, and being aware of repetitive motions can further protect the body from unnecessary wear and tear. Making posture a daily focus can improve comfort and reduce the frequency and severity of pain episodes. Integrative and holistic approaches to chronic pain also focus on the mind-body connection. Techniques such as biofeedback, hypnosis, guided imagery, and visualization help individuals develop greater awareness and control over physiological functions. Biofeedback uses sensors to measure functions like muscle tension, heart rate, and skin temperature, helping people learn to regulate these responses to reduce pain and stress. Guided imagery involves using mental visualization to create calming, healing scenes that promote relaxation and reduce the intensity of pain signals. Hypnotherapy, when practiced by trained professionals, can help shift perception and reduce sensitivity to pain. These techniques offer non-invasive, drug-free options that can complement medical treatment and empower individuals to take an active role in their recovery. Consistent practice of mind-body therapies has been shown to lower pain levels, improve mood, and enhance the ability to cope with chronic discomfort. Creative expression can also provide therapeutic benefits for individuals living with chronic pain. Activities such as painting, writing, music, dance, and crafts offer an outlet for processing emotions and shifting focus away from physical discomfort. Creative tasks often induce a state of flow, where the mind is fully engaged and less aware of pain. Expressive arts therapy uses these creative mediums in a structured way to help people explore their feelings, build resilience, and reconnect with joy. Keeping a pain journal or writing poetry can help articulate feelings that may be difficult to express otherwise. Art and music can be both soothing and empowering, helping individuals reclaim a sense of identity beyond their condition. Engaging in creative activities can also foster a sense of achievement and purpose, which are essential for maintaining motivation and mental health during long-term health challenges. Another important factor in managing chronic pain is pacing and energy conservation. Many individuals fall into the cycle of doing too much on days when they feel good, only to crash the next day with increased pain and fatigue. Learning to pace activities, doing a little at a time, taking breaks, and avoiding overexertion can help prevent flare-ups and maintain more consistent energy levels. Prioritizing tasks, planning rest periods, and using tools like planners or apps to organize the day can help individuals maintain balance. Energy conservation also involves learning to recognize early warning signs of fatigue or pain and responding with appropriate self-care. Adopting the spoon theory or other metaphors can help explain the need for pacing to others and foster better understanding in personal and professional relationships. Adapting the home environment can also make a significant difference in managing chronic pain effectively. A well-designed, supportive living space reduces physical strain and makes everyday tasks more manageable. Simple adjustments like using grab bars in the bathroom, installing railings on stairs, and keeping frequently used items within easy reach can prevent unnecessary bending, twisting, and lifting. Soft lighting, comfortable furniture, and clutter-free pathways contribute to a more relaxing and accessible environment. In the kitchen, using ergonomic tools and organizing items based on how often they're used can reduce joint stress and conserve energy. For those who spend a lot of time in bed or resting, investing in a high-quality mattress, adjustable bed frames, or pressure-relieving cushions can improve comfort and prevent secondary issues like bed sores or additional muscle tension. Even small changes like using electric can openers, voice-activated devices, or lightweight cookware can ease daily burdens and enhance independence. Creating a home that supports healing can reduce frustration and make daily living feel more manageable and less painful. Technology also offers new solutions for those living with chronic pain. Wearable devices such as smartwatches, posture trainers, and fitness trackers can help monitor activity levels, encourage movement, and provide feedback on sleep, heart rate, and stress levels. Pain management apps allow users to log symptoms, set medication reminders, and track patterns over time. Some apps also include guided exercises, relaxation techniques, and educational resources to help users better understand their condition. Telehealth services have become increasingly important, offering convenient access to pain specialists, physical therapists, and mental health professionals without the need for travel. Online support groups, virtual exercise classes, and remote coaching programs allow individuals to stay connected and engaged even from home. Embracing these digital tools can enhance self-care, provide motivation, and improve communication with healthcare providers. By leveraging technology, people with chronic pain can stay more informed, active, and connected to the resources they need. Relationships often shift when someone is living with chronic pain. Friends and family may not always understand the limits or emotional strain associated with persistent pain. Open, honest communication is essential to maintaining healthy relationships and receiving the support needed. Explaining the condition in clear, relatable terms can help others grasp its impact. Setting boundaries is also important, not out of selfishness, but to preserve energy and manage symptoms. It's okay to decline invitations, ask for help, or take time for self-care without guilt. At the same time, nurturing relationships with those who are supportive and encouraging can provide emotional strength and reduce feelings